Hey guys, it's Dr. Justin Marchegiani here. Welcome to today's podcast. Evan, how are we doing today, man? Really excited that we got a chance to chat and dive in a little bit.
Yeah, let's have some fun. We're going to talk about float tanks today, which is something that I haven't done as much as I should have since I moved back to Kentucky from Austin. When I was in Austin, I was floating all the time, but since I got back here, I haven't done it as much, but I'm inspired. So let's talk about this. This is a good tool to have in the toolbox.
100%, man. Yep, 100%. Really excited to dive in. So one of the best things of float tank therapy, kind of the best things of it, best aspects of it is a couple. So first thing is just decreasing all of the input, the sensory input takes that sympathetic nervous system, that fight or flight nervous system response that's taking in data auditory, visually, tactile. It's sensing everything. And then it's trying to see, should I be on alert? Is this safe? Is this not? When we take all of the output or all of the input, audio, visual, everything, one, it calms down the sympathetic nervous system. Once you kind of realize that you're in a safe place, then you're not going to drown. Because I remember when I first got in the float tank, I kind of freaked out for a minute. Because you're like, where the heck am I? I'm in this like cocoon. I'm stuck. It's dark. I'm in water, and you kind of freak out a little bit. But once you can kind of calm down and relax, it's like, whoa, there's no input coming in. Your nervous system can finally start to relax. And then we have the benefit of hundreds of pounds of magnesium crystals or magnesium salts in the water. So then we have this massive surface area, aka your whole body, sucking in all these minerals. And the minerals is what allows you to be more flotatious, if you will, right? You're on top of the water, you're floating. And then that's going to also drive more of a parasympathetic nervous system response. Because we know how magnesium, it's a natural beta blocker, relax the heart. It helps facilitate GABA working better, which is a really good inhibitory neurotransmitter. It turns down the sympathetic nervous system response and activates the parasympathetic response.
Yeah,
Any comments there off the bat, Evan?
That's all awesome. I'm going to go way back in time before float tanks even happened and talk about how they came in, because it's kind of a cool story. Dr. John Lilly, he's a neuroscientist. He's dead now. He passed away in 2001. He was born in like 1915. Anyway, John Lilly, he actually got hired by the National Institute of Mental Health in 1954. I mean, this is a long time ago. And the goal of the National Institute of Mental Health they were trying to isolate the brain from external stimulation. So they hired John Lilly. They said, okay, we need you to get a brain completely away from all sources of stimulation. And so that's how he developed the float tank. And I'm sure they were very crude compared to the float tanks now. They're amazing. But then it became recognized as REST, which is restricted environmental stimulation technique. And I mean, that we're talking 1954. This is a long time ago. He did some other stuff too. Like he was working with dolphins. He was trying to communicate with dolphins inside of a float tank, and he was doing psychedelics before getting in float tanks.
Oh, wow.
So he was doing some other interesting things, but really he is the godfather. And so now there's float tanks everywhere. So if people just look up flotation locations, or there's another website, Where to Float, or just Google, New York float tank, and I'm sure you can find some places. But really what it is, it's basically a giant bathtub. My personal preference is what's called the ocean float room. It's the biggest. They have other ones like clamshell type tanks, but yes, the ocean float rooms are the best because they're so big. It's just a big door. It's like 10 feet tall, 10 feet wide, 10 feet long. I mean, they're just gigantic. And that way you don't bump into the walls. But, the water is the same temperature as your skin. So they call it skin receptor neutral. So when you get inside of this about 10 inches of water, you don't even feel the water after a while. Your skin gets used to that feeling, and you're not claustrophobic. That's one fear people have about float tanks as well. I don't want to be in a dark enclosed space. That doesn't sound relaxing to me. Well, after you're floating for a while, you have no sense of gravity because of the magnesium. You have no sense of space or depth because of the darkness. So really, as far as you're floating in outer space. So I'd like to address that concern that people have with these float tanks, because that was my concern at first, but 5-10 minutes in, you're fine. And you lay there.
I had the same issue. So it took me a few minutes just to kind of wrap my head around, okay, what's this environment? Like, am I okay? Am I safe? Am I going to drown? So it's kind of getting your head wrapped around the safety of the place. And then once you feel good about it, that magnesium just starts to creep into your bloodstream, and you just start getting really relaxed. Now, one of the big things I would do in the float tank is I would do a lot of Wim Hof breathing, and that was super, super helpful. And we can put an article or a video on how to do that, but that was really, really helpful. I would do a lot of meditation and or just visualization, and it was just really great to calm my nervous system down. So I think typically I would do a float tank kind of therapy, and then I would do a massage right after because my muscles are so relaxed. So if you guys want a parasympathetic weekend or afternoon, float tank combined by a really nice massage afterwards, your muscles are like putty.
Yeah, or vice versa. If some people are too anxious to get into the float tank, typically these float tanks are in a spa setting. So you could always go in and there may be a massage therapist on staff where you could do a massage before to relax you enough to not be afraid of the float tank. But really the fear is unwarranted. There's really nothing to be afraid of. The biggest concern you may have is you get a little bead of sweat with some salt water into your eye, and then you got to wipe your eye out. But beyond that, there's really no concern for anyone.
Yeah. And Matt White kind of wrote in here on the YouTube chat, will it help with muscles? Yeah, definitely will. Now, Matt was talking about his serratus posterior. So that's going to be the serratus. That's like a rib muscle, right? So that kind of connects into the rib. So you'd want to get some myofascial release work done. And if it's hurting or kind of causing a problem while you're in the tank, I'd probably get some myofascial release work done before and then go on the float tank after. But the magnesium is known to help relax the muscles. So it kind of helps, depolarize that muscle, relaxes it. So that's a good first step, and that should help you a lot. That should allow you to enjoy the therapy better, because really the goal is that we're just trying to decrease the sympathetic nervous system response. So when we see patients with adrenal dysfunction, we're doing the same thing. We're not using float tank therapy. That's an adjunct thing we can add into it, but we're trying to clean up foods that are driving the sympathetic response. Inflammation, giving nutrients to support healing, using adaptogens which help the HPA axis, brain to adrenal communication loop, but also affects the perception of stress, right? Some people deal with stress better, and it's how they perceive it. And part of using adaptogens is adaptogens can help how you perceive stress. So if you perceive it better, then there's less HPA axis brain communication crosstalk between your adrenals and your brain, which means you're less likely to over-secrete cortisol or over-secrete adrenaline, and you're more than likely to adapt to the situation. And one of the big things I tell my patients when you're going into stress, and it's the same thing I'll do in a float tank, is the number one thing you have control over is controlling your breath. If you can control your breath, for the most part, you can control that sympathetic nervous system response. So basically 4 breaths in through the nose, and then out to the mouth. Some people say into the nose, hold for a second, and then out to the nose again, 4 seconds. So it's kind of a 4 in, hold for a second, and then 4 out. Hold for a second. And that's just box breathing, but the breathing through the nose is what stimulates that parasympathetic nervous system response. This is cranial number 2 in the nasal area, which hits the brainstem, and that activates. That's part of the vagus nerve system, right? So, the vagus plugs into the parasympathetics. I think it's like 1, 2, 5, 7, 9 hit the parasympathetic branch, and the vagus is the key one. That's number 10, but number 2, which is the olfactory, is really important. It plugs into that parasympathetic response, allows you to start hitting the brakes. So that's really good. So anytime you're in stress, really work on nasal breathing, allowing the belly to distend when you breathe in. That allows all the organs to move down. It allows you to get a deep breath of air, and you're breathing through the belly. You're not breathing through these intercostal muscles. So I wouldn't be surprised if someone like Matt was talking about here, you're going to put more stress on your chest and on your ribs when you're a mouth breather, and when your chest has to rise to breathe, it should all be here. It should all be in the belly.
Yeah, I love watching. I've got a little girl who's, what is she, 6 weeks old now? I love watching her breathe because she is 100% belly breathing. She hasn't been conditioned yet with stress and fear and anxiety to be a mouth breather. I sent you a study, so if you can check it out. I can't put it in the YouTube comment because YouTube won't allow me to put links, but I sent it to you, Justin, in the Hangout chat. It's really cool. It's a PubMed. You ought to look at the 1, 2, 3, third picture in this study. This was in the February of 2018. It was called Examining the Short-Term Anxiolytic and Antidepressant Effect of Flotation. And there's a third picture there. It's incredible. It's a huge list of all these different positive symptoms that we're seeing. And so the biggest benefits were heightened creativity, heightened energy, feelings of euphoria, joy, or happiness, heightened focus and ability to concentrate, a strong feeling of appreciation that you're alive, a feeling of flow with the world around you, a pain-free existence, feeling completely refreshed, relaxation of body without muscle tension, a feeling of total serenity and peacefulness. So in this study, this is all the positive effects that we're seeing. And then, of course, a reduction of anxiety and fear. And, we've used it a lot for trauma too. My friend who had the float tank center down in Texas, he had a lot of veterans that would come in with PTSD and they would get in a float tank. And of course, you can't legally say cure, but let's just say the PTSD was dissolving very rapidly with these guys who, if they heard a loud sound, for example, they would get freaked out because they were around explosions in war. This had calmed the amygdala, the fear center of the brain, enough to where they no longer had that fear response. So to me, this is so cool. Now, some may ask, well, why don't you just get a float tank in your house? Then you could just do it all the time. I'm home so much now. I want to be out of my house. I don't want to be home anymore. So I like the idea of driving somewhere and having the 20 minutes of anticipation of going to visit a spa like setting, showering there, getting all clean, and then having that 20 minutes of relaxed time by myself on the way back home. Now, if you're never at your house, maybe your story is different. But for me, that's why I like to go to a spa. I don't want to deal with the maintenance of it. It's expensive. I mean, you're looking at 10 grand to buy a float tank versus 60 to 70 bucks to have one for an hour. You got salt water everywhere that's going to be all over your floor. You've got to clean up. You've got to maintenance it and focus on your water filtration system all the time. It's just, to me, buying one is just not something that's worth it.
Totally. And just a little correction. It's cranial nerve number 1 is olfactory. So
Okay.
1 is the nose, 2 is the eyes. I confuse them. And then in general, I'm seeing that it's saying that number 1 cranial nerve, the olfactory, does not plug into the parasympathetic nervous system. Just an FYI, a little correction. But I've seen a lot of data where that nasal breathing does improve heart rate variability and does improve other markers of parasympathetic nervous system response. So I'm not sure if it's just an anatomical thing, but it still may have an effect on the parasympathetic nervous system based on HRV and based on other brainwave data showing that you're in a state of relaxation and healing and recovery.
Yeah, that makes sense.
So the big nerves for parasympathetic are going to be number 3, which is going to be the oculomotor. That's the eyes. That's the moving of the eyes. It's going to be obviously the vagus nerve, right? That's number 10. That's the big one that creeps throughout the whole entire body. We have number 5, trigeminal, which controls the face. And then number 7, which controls the sensory on the face. And then 9, which controls the tongue, right? That's why people say singing helps with parasympathetic, or they'll do tongue depressor or gargling because that works the number 9 there. And then, of course, number 10, the vagus, which same thing. You'll do the tongue depression and the singing for number 10 because they work the back of the palate as well. And it creeps throughout the whole entire body. So the vagus nerve is that parasympathetic branch, and that really essentially creeps through your whole entire body like a spider web, and it really works on promoting relaxation. And I guarantee you, if we look a little bit more, we're going to see the vagus nerve being upregulated with deep nasal breathing. And then if you combine the magnesium salts in there and you decrease all of that other sensory input, we're really just driving a parasympathetic response. And these types of therapies, and you tell me if you think I'm off, are a really great adjunct to a functional medicine program. They really help promote healing. They're not going to do it in and of itself. If you have infections or other stressors that aren't being addressed, or your diet's poor, it's not going to be enough to overcome that, but it's definitely a nice step in the right direction. And if you can combine it with other healthy lifestyle factors and supplement factors, you're really on the right direction to heal.
Yeah, I agree. I actually did a podcast this morning, or it was a summit interview all about anxiety and the gut brain connection. And I made the disclaimer because I was being interviewed for float tanks. And the question that was presented to me was, well, how do float tanks help digestive problems? And I said, well, hold on, let me give the disclaimer that, yeah, float tanks may help calm the nerves and therefore calm the stomach. Like if you had irritable bowel syndrome or something like that, when I had digestive issues and parasites and other problems, and I would use a float tank, I would get some relief. But I gave the disclaimer that, look, if you have gut bugs, you still have gut bugs. You still got to get your testing done with your practitioner. You still got to get rid of H. pylori. You still got to get rid of parasites. However, the stress on the system can be relieved by the float tank. So the question was kind of like assumed that the float tank would magically dissolve those problems. So I had to just tell the host, look, no, it doesn't work that way. You still got to do the other work. I think a lot of therapies get that type of treatment where someone says, well, how does a massage help anxiety? It's like, well, it can, but why is the anxiety there? Is it something in the system creating anxiety? Like we still have to work backwards to that. And I think this is why so many people spend money on stuff, but then they still need further help. It's because that was what do you always call it? Palliative care versus root cause?
Exactly. Yep. It totally can.
So
and we want to draw that line.
So I would recommend, start out to do an hour. You could do an hour float tank session. I prefer 90 minutes because 90 minutes, you really have that extra time to really settle down. I find that it takes me a good 15, 20 minutes to settle in. And then 40 minutes or so is left to relax. That's just not enough. So the 90-minute session allows you to really get out of your body. And I've had out of body experiences where literally I'm looking back at myself in the float tank from a third person perspective, where I was just gone. Now, not everybody can relax. And I've only had a couple sessions like that where maybe I was relaxed enough to leave my body, but it can be very, very mind expanding. Like if you're stuck in a rut and let's say you're trying to write a book, or you don't know what to do about your marriage, or you don't know where to move, or you don't know what to do about your job. This is a good place where you can go and really gather all those thoughts and kind of run through your Rolodex, if you will, of all the thoughts on your mind and basically reorganize your stressors, as opposed to most people, all the stressors get interweaved and tangled. And you can't really break apart your stress because it's all this ball of stress. Like when we work with clients, you and I always ask about stress. Like, what are the sources of stress? But for so many people, it becomes this tangled ball. But a float tank, a massage, myofascial work, as you mentioned earlier, those things can help kind of detangle the stress. And then you can identify, oh, it's stress about money, or it's stress about relationship, or stress about my job, or stress about my parents who are sick. It could be a good tool to help recalibrate your, I guess, or allow you to analyze your stress, if that makes sense.
100%. I think it's great. I think the more you can get that parasympathetic nervous system response down and you can be more introspective like that, I think it really helps and it allows you to make better decisions. The more your parasympathetic response, and most people are in this chronic fight or flight, whether it's from inflammation, whether it's from blood sugar, the more fight or flight response you're in, the more that sympathetic nervous system is activated, we have decreased blood flow and oxygenation to the frontal cortex. This is the neocortex. This is what allows us to have deeper thinking. The frontal cortex, or the neocortex, allows us to control poor decisions. We're going to make a bad action. We're going to say the wrong thing. We're going to do something physically that we're going to regret. The frontal cortex helps you basically prevent that action from happening. It allows you to look at consequences better. And I think a lot of people, if they're more sympathetic dominant they are, the more their adrenals are incredibly stressed on the cortisol and adrenaline side, you're less likely to be able to control impulses. You're less likely to look at the consequences of poor decisions. So really important. The more we can get that parasympathetic response going, the more our brain can look at outcomes better and help us make better decisions, which is really important.
Yeah, well, think about our ancestors. They had a lot more time to be in that parasympathetic rest and digest, right? Like the men were out hunting, they were in the woods, they were in the fields, they're hunting and looking for food. The women were socializing and hanging out with one another. Now, if you've got a stay-at-home mom who's just listening to our podcast, she's socially isolated. So maybe we're giving her some company. Hello, hopefully we're giving you some company. However, they're still socially isolated, right? They're not in their tribe anymore. And the men, they're stuck working and they're not with their guys. They're not with that tribe relaxing. So I think if we were to compare the amount of time our ancestors, let's say 5,000 years ago, spent in parasympathetic versus today, I would say it's completely flip-flopped. I would say it's like 1% of the time people relax now, where previously there was always relaxation built into the day because there wasn't as many external sources. You're in the middle of the woods having a campfire, cooking your elk, and that was it.
Exactly. Well, I'm glad that we at least kind of talk about some of the strategies. We can draw the line between palliative and root cause. And if you're working with a functional medicine practitioner or a nutritionist that's helping you get to the root cause of what's going on, adding this therapy in, I think, is excellent. And I would recommend adding it in with some good box breathing, deep nasal breathing. Put your hand on your chest and your hand on your tummy. You want to make sure the bottom hand, the tummy hand, is what moves out when you breathe in, and then back in when you breathe out. And make sure this top hand, the chest hand, if anyone's listening, there's a video, YouTube video available in the description. Make sure the top hand's not moving and make sure the bottom hand's moving. These are just really, really simple things you can do. And then also keeping good alignment as well. I mean, when you're floating, it's easier to keep good alignment because gravity is like, significantly less. It's 2 to 3x less when you're already laying horizontal in the water, and the water perfectly kind of, comforts your body as well, which is great.
This would be something. This would be something good for pregnant women as well. If you've got that pregnancy belly growing, a lot of women may report low back pain or just feeling uncomfortable with the growing baby. And so I do recommend pregnant women use float tanks as well. I've had some women where I was in the float tank center in Texas, and then I would see a couple pregnant women come out. They always reported that they felt more connected to their baby. And it was almost this sort of prenatal connection that they had to the baby while they were in there. They said that they felt like they were almost in the womb with the baby. So it was a really good emotional bonding experience too. And of course, it takes the weight off of you. So women out there with pregnant bellies, there you go. Go try it out. I think it could be very therapeutic.
Excellent, Evan. Well, anything else you want to mention today?
I would just tell people, do some Googling, go find a place, look for the ocean float room if you can. There's nothing wrong with the smaller tanks. There's nothing wrong with the clamshell style float tanks. They're still good, but for the best experience, the bigger, the better. And so if you can find a place where you can fully extend your arms are not going to hit the walls. You can just go and do gymnastics in there. You're going to feel great. And make sure you're still addressing the root cause though. If you've got an anxiety problem, you can't sleep, you've got joint pain, you've got arthritis, which some people wrote about in the comments here, you got to find the root cause of those things. This may help, but there's a reason. So feel free to reach out to Justin. His website is justinhealth.com. He works with people all around the world. So it doesn't matter where you're listening, you can get help. And if you want to reach out to me, my site is evanbrand.com. We look forward to helping you. We are very blessed to be able to help people and to put this in the toolbox, because your doctor down the street, they don't know anything about float tanks. So you're never going to get recommended that. If you have pain, you're going to get a painkiller. If you have anxiety, you're going to get an anti-anxiety med. We say, no, that's not the root cause. It's not a deficiency of pharmaceuticals.
Exactly. And then we'll give our friend a plug down in Austin. He's over at the Zero Gravity Institute. I've gone there many times. Is that where it's Zero Gravity, right?
Yes, Kevin. Hello, Kevin. If you're listening, I talked to Kevin a year ago, and he's like, man, he's like, I still listen to every episode of your podcast, don't you? And I'm like, oh, great. So Kevin, if you're listening, hello, thank you so much. I hope you're doing well. And I miss floating at your place. It's very, very awesome and high tech. So go visit him if you're in Austin, Texas.
Yeah, zerogravityinstitute.com. We'll put it in the show notes. If you go in there, let them know that we referred you guys in, and I hope you guys enjoy it and just kind of put this as one other tool in your metabolic toolbox to improve your health and get you guys functioning as optimally as possible.
Good chat. Take care.
Evan, have a good one. You guys take care. And also, I'll be back for a live Q&A in just a bit. So if you guys want to hang out in maybe 30 minutes to an hour, I'll be back to answer some questions and to dive deeper in to help you guys improve your health. You guys take care. We'll talk soon.
See you later. Bye.
Bye.